So what are we talking about? Amma, wait. So we are talking about the abdominal aorta. We are talking about the abdominal aorta, and this particular abdominal aorta is giving rise to two types of aorta. So first one is visceral, second one is parietal. So we are talking about unpaired branches that are arising from the visceral branches. Okay, unpaired visceral branches. So from where they are arising is they are mainly arising from celiac trunk. So from celiac trunk, what are the branches that are coming actually? From celiac trunk, what are the branches that are coming? So from celiac trunk, we have celiac artery. Yes or no? So this celiac artery is further divided into left gastric artery, splenic artery. This splenic artery is further divided into pancreatic artery, gastromental artery, and short gastric artery. Next we have common hepatic artery. These common hepatic arteries are divided into proper hepatic artery, right gastric artery, gastroduodenal artery. Gastroduodenal artery. Next. So what is the first part that is there? Celiac trunk. Yes or no? Yes or no? Yes, so what is the celiac trunk is doing? This celiac trunk is supplying. Just look at this. So this celiac trunk is supplying to gastrointestinal tract. Okay, gastrointestinal tract that arise from embryonic organ, mainly abdominal part of esophagus to duodenum, also spleen. So it is including abdominal part of esophagus, duodenum and spleen. Duodenum and spleen. Now listen to me carefully. So you have left gastric artery. What it is, ma? Left gastric artery. This left gastric artery is supplying to abdominal part of esophagus. Abdominal part of esophagus and lesser curvature of stomach. Lesser curvature of stomach, lesser omentum. What is this lesser curvature of stomach, lower curvature of stomach means? When you look at the stomach, it has greater curvature, it has lesser curvature. Okay, it will be clear to you when we are studying about the parts of stomach. When we are studying about the parts of stomach. And now, as we have discussed here, we are discussing about the type of arteries that are coming. So, this is the superior mesenteric artery, which is divided into 5 types: inferior pancreatic-duodenal artery, jejunal artery, ileocholic artery, right ileocholic artery, middle cholic artery. Next we have inferior mesenteric artery. We have inferior mesenteric artery. So this mesenteric artery is having left cholic artery, sigmoid artery, superior rectal artery. Superior rectal artery. Make it fast. Don't waste my time. No. Now we have discussed about the unpaired visceral branches. Yes or no? Yes or no?
Yes, sir.
Now we need to discuss about paired visceral branches. We need to discuss about paired visceral branches. Exactly. What are these paired visceral branches? So we have in unpaired we have superior and inferior mesenteric arteries. Yes or no? Yes or no?
Yes, sir.
And what is the other one that we have? Superior mesenteric artery, inferior mesenteric artery, and left gastric artery, splenic artery, hepatic artery. Yes or no? Yes or no?
Yes, sir.
Yes. Now we are talking about paired visceral branches. We are talking about paired visceral branches. First we are talking about the unpaired branches. First we are talking about the unpaired. What are the three major arteries present in unpaired branches? Celiac trunk. Next. Celiac trunk, superior mesenteric artery, inferior mesenteric artery. In celiac trunk, what are the further dividings? Lactic acid artery, sphenic artery, common hepatic artery. మళ్ళీ superior mesenteric artery తర్వాత listen. Unpaired visceral branches are three types. Celiac, inferior mesenteric artery. Don't get confused. Three major arteries are there. First one is what? Celiac artery. First one is celiac artery. These are unpaired. This is superior and this is inferior. Now, in celiac artery we have three major arteries. In celiac arteries, how many arteries are there? Three major. First one is lactic gastric, second one is splenic, and third one is common hepatic. Now, gastric artery is supplying the stomach. Gastric artery directly supplying to stomach. Now, splenic artery is further divided into pancreatic artery, left gastromedullary artery, short gastric artery. That means splenic, the name itself is saying spleen. So spleen is there. Pancreas, the name itself is saying pancreas. So pancreas is there. Yes or no? Yes, sir. Next, so that's why maniki stomach lo fundus ane part undamma. There is a part which is called as fundus. There is a part which is called as greater curvature. There is a part which is called as greater stomach. అంటే స్ప్లీనిక్ అంటే ఎక్కడికి వెళ్తున్నప్పుడు స్ప్లీన్ వెళ్తుంది, ప్యాంక్రియాస్ వెళ్తుంది, స్టమక్ వెళ్తుంది. Where it is going? Spleen, pancreas, stomach. That means this celiac artery is mainly supplying to gastrointestinal tract, mainly spleen, esophagus, stomach, and pancreas and spleen. The five organs are only five organs came or not? Next, what we have? Common hepatic artery. Now, hepatic, which is related to liver. Which is related to liver. So automatically liver ochindi alega. Yes or no? Yes, sir. Now, gastroduodenal. Entama? Gastroduodenal. Gastroduodenal ante duodenum involve ayinda leda? Yes or no? Yes or no? Because duodenum ochindi ikkada. Now, gastric antadu. So stomach malli involve ayinda? Stomach parts anamata, lesser curvature, lesser omentum. Ochindha? Now, proper hepatic. So hepatic artery nunchi branches vastayi. Hepatic artery means what is coming? Branches are coming. So now, from liver, bile juice is secreted and stored in which place? Gallbladder. From liver, bile juice is secreted and stored in which place? Gallbladder. Artery does. This is what the common hepatic artery does. Am I clear? Yes or no? Yes, sir. Yes or no? Yes, sir. So these are the parts. So main ga manaki celiac trunk. When we talk about celiac trunk artery, it is supplying blood to stomach, pancreas, duodenum, spleen, and ఇంకేమన్నా ఇక్కడ స్టమక్ లో వస్తుంది కదా duodenum, pancreas, liver. Yes or no? Yes, sir. Yes, sir. Spleen. So the stomach. These are the five organs this celiac trunk artery is supplying. This celiac artery is supplying five organs. Entama five organs? Stomach, spleen. Yes or no? Esophagus. Yes or no? Stomach. Yes or no? Duodenum. Yes or no? Liver. Gallbladder. Yes or no? So these are the parts which are supplied by celiac trunk artery. These are the parts which are supplied by celiac trunk artery. Now superior mesenteric artery. ఏమన్నాయమ్మా? Superior mesenteric artery. Now superior mesenteric artery. First one ఏంటి? Inferior pancreatoduodenal. Inferior అంటే superior ama anterior అంటారమ్మా, inferior downwards. ఏంటమ్మా? Downwards. So ఇప్పుడు inferior అంటే down part of pancreas, inferior part of pancreas, inferior part of duodenum. Yes or no? Yes or no? So pancreas and duodenum. ఇచ్చడా? Pancreas and duodenum. Now ఇప్పుడు jejunal. Jejunum అంటే ఏంటనుకుంటున్నారు? Jejunum is the small intestine. Duodenum, jejunum, ileum. Duodenum, jejunum, ileum. These three are small intestine. These three are called as small intestine. So jejunum supplied kada. Followed by jejunum we have ileum. Followed by jejunum we have ileum. So jejunum and ileum. That's why jejunal artery. That's why we have jejunal artery. Now ileocholic artery. Now duodenum, jejunum, ileum. Ileum is a small part of small intestine. Small part of small intestine. So ileum kalkuna alatlela. Yes or no? Yes, sir. Yes or no? Yes, sir. I'll show you. Wait. So if I have to show you, if you have to understand, I need to show you this particular point. Just give me a moment. Again. So then we have parietal branches, we have visceral branches. Yes or no? Yes, we have parietal branches and we have visceral branches. So in the parietal branches, these are visceral branches. Now visceral branches lo unpaired lo celiac trunk artery అని చెప్పానా? Yes sir. Superior mesenteric artery అని చెప్పానా? Yes sir. Inferior mesenteric artery అని చెప్పానా? Yes sir. Yes or no? Yes, so we have superior mesenteric artery, you have inferior mesenteric artery. Now we are talking about celiac trunk. What ma? Celiac trunk. Now what are the arteries that are present in the celiac trunk? What are the arteries that are present in the celiac trunk? What are the arteries that are present in the celiac trunk means these are the arteries that are present in the celiac trunk. చూడండి ఇక్కడ I will show you. Now whatever I have said to you, they will be here. You have short gastric artery. Yes sir. You have splenic artery. Yes sir. We have left gastric artery. Yes sir. We have left gastromental artery. Yes, right gastric artery. Yes sir. Common hepatic artery. Yes sir. Proper hepatic artery. Yes sir. Pancreatic artery. Yes sir. And gastromental artery. Right gastromental artery is there. Left gastromental artery is there. Right gastric is there. Left gastric is there. Splenic artery is there. Short gastric artery is there. Common hepatic artery is there. Yes or no? Yes sir. So these are all the arteries which are coming from the celiac trunk. These are all the arteries which are coming from the celiac trunk. Yes or no? Yes sir. So look at this picture here. So this is the branches that arise from the celiac trunk. These are the branches that are arise from the celiac trunk. Now we have to talk about superior mesenteric artery. We have to talk about superior mesenteric artery. Now what are the arteries that came from superior mesenteric arteries means you have suprarenal artery. You have what ma? Suprarenal artery. You have middle colic artery. You have what ma? Middle colic artery. Now you have inferior pancreatic duodenal artery. Inferior pancreatic duodenal artery. You have right colic artery. You have right colic artery. You have iliocolic artery. You have what, ma? Iliocolic artery. You have superior rectal artery. You have superior rectal artery. Now you have sigmoidal artery. You have sigmoidal artery. You have left colic artery. What do you have? Left colic artery. You have jejunal artery. You have renal artery. We have what, ma? Renal artery. Now, winner. Look at this. What are the parts that are present in the intestine? Listen to me carefully. So you have rectum. Yes or no? Yes, sir. You have appendix. Yes, sir. You have sigmoid colon. Yes, sir. You have cecum. Yes, sir. You have descending colon, ascending colon, transverse colon. Ascending colon, descending colon, transverse colon are nothing but large intestine. Are nothing but large intestine. Duodenum, jejunum, ileum are nothing but small intestine. Duodenum, jejunum, ileum are nothing but small intestine. Are nothing but small intestine. Now we have gallbladder. You have liver. You have stomach. You have spleen. You have pancreas. How many types are there here? We have liver. So definitely we should have one artery which is supplying to liver. Yes or no? Yes, sir. Now here liver is not alone. It is a big one of the big organ. It has a right side. It has left side. It has superior, inferior, and middle. So superior part is supplied by what artery? Inferior part is supplied by what artery? Understand? So that is what you have different types of hepatic arteries. Next we have gallbladder. Now what part of the artery supply? Gallbladder. Next we have spleen. So that's why there is a special artery which is called as splenic artery. There is a special artery which is called as splenic artery. Next we have large intestine. Large intestine has transverse colon. Yes or no? Yes, sir. Ascending colon. Yes, sir. Descending colon. Yes, sir. Cecum. Yes or no? Yes, sir. Sigmoid colon. Yes, sir. Yes or no? Yes, sir. So the appendix is there, rectum is there, anal is there. All these parts should be supplied. Supplied by what? Arteries. All these parts should be supplied by what? Arteries. That is what you have. These many branches here. That is what you have. These many. Now, jejunal artery is supplied to jejunum. Yes or no? Yes. Colic artery. There is ascending colon, descending colon, transverse colon. So to colon it is supplying. Right side it means it is supplying to right side colon. Okay. Ascending colon means ascending colon, descending colon means descending. Now middle colon it might be transverse colon. Pancreoduodenal, that means it is supplying to pancreas as well as duodenum. It is supplying renal. Now what is this renal? Now when you look at this particular picture, so behind this, all these are abdominal organs, yes or no? Yes, sir. All these are abdominal organs. What are abdominal organs? I will show you. Wait. Abdominal. Now, look at this. See ya. Kita masih seragam. So, so we have kidneys, yes or no?
Yes, sir.
Now, above the kidney, you have adrenal gland, yes or no?
Yes, sir.
Now, listen to me. Listen. You have renal artery, renal gland. It is there or not?
Yes,
Kidneys, both the kidneys. So that's why you have renal arteries. You have spleen. That's why you have splenic artery. You have adrenal gland. Now adrenal glands also should be supplied. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
So that is why this abdominal aorta is giving rise to these many branches. You understood? Depending upon the type of organ that is present. Depending upon the type of organ that is present. Now, above it has renal glands. Now we have again what type of organs we have? What type of organs we have? Yes or no?
Yes, sir.
What we have? Jejunum, we have ileum, we have stomach, we have spleen. Sigmoid colon is also present. Anus is present. Rectum is present. So superior rectum means superior part of the rectum. Superior part of the rectum. So this is the blood supply. So what is supplying here? Inferior mesenteric artery. What is supplying? Inferior mesenteric artery and superior mesenteric artery. Inferior mesenteric artery and
Superior mesenteric artery.
so this is the blood supply of inferior and superior mesenteric arteries. Inferior and superior mesenteric
Arteries.
So this is the schematic representation. This is the schematic representation. So if you turn your textbooks to page number 4.27. 4.27. Arterial supply. Yes or no? So we have an artery which is supplying to phrenic. So we have a phrenic artery that is nothing but celiac trunk is there. From celiac trunk we have left gastric artery, we have renal artery, common hepatic artery, gonadal arteries. Gonadal artery is nothing but I told you no. If it is male, testicular artery. If it is female, ovarian artery. Next, superior mesenteric artery, inferior mesenteric artery, right and left common iliac arteries, external iliac artery. External iliac artery. So these are the external iliac. These arteries are the iliac arteries. They further divided into external and internal arteries. External and internal arteries. External and internal arteries. Now, if you want to go further in detail, so that is how each artery how it is supplied. It will be present over here. This is abdominal aorta. So what is right gastromentum? This is if it is this is gastric region. This is anterior view of celiac trunk and its branches. As you can see. Okay, I am not going to touch this part. This part is enough for it. Which part? What are paid branches? What are unpaid branches? So what are paid branches here? Inferior phrenic arteries. What are paid branches, ma? Inferior phrenic arteries. These supply blood to diaphragm. Where it is supplying? It is supplying blood to diaphragm. Next we have renal arteries. What ma? Renal arteries. Now what are these renal arteries? These renal arteries are supplying blood to. These renal arteries are supplying blood to what? Both the kidneys. Right kidney and left kidney. Right kidney and left kidney. Next we have testicular arteries. Nothing but gonadal arteries. Nothing but gonadal arteries. Now testicular arteries they give blood to what? Testes. They give blood to what? Testes. Next we have ovarian arteries. Ovarian arteries give blood supply to ovaries. Ovarian arteries give blood supply to ovaries. Now these are paired vessel branches. These are paired. So we have suprarenal arteries, we have renal arteries, gonadal arteries. Gonadal. Now what is paired parietal arteries means? We have inferior phrenic arteries, we have lumbar arteries, which is not there in textbook, which is there not there in your textbook. So paired branches means you remember those four names: inferior phrenic artery, renal artery, testicular artery, ovarian artery. Finish. Paired branches, unpaired branches are left gastric artery, splenic artery, hepatic artery, superior mesenteric artery, inferior mesenteric artery. Superior mesenteric artery, inferior mesenteric artery. Turn your pages to page number 4.27. 4.27. 4.27. Their paired branches are there. You just look into it. Paired branches. Four branches on them. Now, what is paired means they are present both left side and right side. They are present both left side and right side. What are these four? Inferior phrenic artery, renal artery, testicular arteries, or ovarian arteries. Now, there are another type of branches which are unpaired branches. These are
Unpaired branches.
So only one is coming. We don't have left and right. Only one. So that is left gastric artery, splenic artery, hepatic artery, and superior mesenteric artery, inferior mesenteric artery. Superior mesenteric artery,
Inferior mesenteric artery.
Now, if you look at the 4.22, you can understand 4.22. Picture number 4.22. 4.22. Picture number 4.22. So they are. Some books it is different, I think. Yeah, here it is at 4.22. 4.22. Figure number 4.22. Move it. Put it below. Now this is the arterial supply to abdomen. This is the arterial supply to
Abdomen.
So we have paired, we have unpaired. In paired we have mainly three types. First one is inferior phrenic artery, second one is renal artery, third one is gonadal arteries. Third one is what, ma?
Gonadal arteries.
If it is male, testicular artery. If it is female,
Ovarian arteries.
finish paired. What is unpaired means we have left gastric artery,
Splenic artery, hepatic artery,
superior mesenteric artery,
inferior mesenteric artery.
superior mesenteric artery.
Inferior mesenteric artery.
Page number 4.27, figure number 4.22. Have you seen? So that is what the branches. That is what the branches. Now we'll see what is the venous return from the abdomen. We'll see what is the venous return from the abdomen. ఇప్పుడు అబ్డోమినల్ ఆర్గాన్స్ కి ఏ ఆర్టరీస్ బ్లడ్ సప్లై చేస్తాయంటే పెయిడ్ ఆర్టరీస్ ఉన్నాయి, అంపైర్ ఆర్టరీస్ ఉన్నాయి. పెయిడ్ లో ఫ్రెనిక్ ఆర్టరీస్ ఉన్నాయి. ఫ్రెనిక్ ఆర్టరీస్ ఆర్ గివింగ్ బ్లడ్ టు డయాఫ్రామ్. Phrenic arteries are giving blood to, renal arteries are giving blood to kidneys. Renal arteries are giving blood to
Kidneys.
Next, what do we have? We have gonadal arteries. If it is male, they are giving to male testicular arteries. If it is female, they are giving to ovarian arteries. Don't get confused between ovarian and. So these are simply called as gonadal arteries. These are simply called as
Gonadal arteries.
Now we know what is superior mesenteric artery, what is splenic artery. Splenic artery is giving blood supply to spleen. Hepatic artery is being supplied to liver. And superior mesenteric artery is giving supply to colon. Is there no? Yes or no? Colon is there. Ascending colon, descending colon, iliac region. These. So digestive system. As well as inferior mesenteric artery also giving supply to digestive system. Finished. So if you confuse or you are getting confused. If I am going deep, you are getting confused. So I am trying to finish it off above itself. You are getting confused. You are not understanding. If I am going into deep, you are not understanding. That's why I am following your vision. That is torpora. Torpora, that is level, like higher level, little higher level. Not between, it is more higher level. I thought you will understand, but you are getting confused. So this is normal classification. You know what is visceral classification? What is parietal classification? For visceral and which were supplying inside, parietal which were supplying outside. But these are sub classifications under. I don't want to confuse you. Just bring it here. Leave it here. Okay. Paid and finish. Paid and finish. Okay. Now venous return. What mark?
Venous return.
Now in venous external iliac vein, we have 3. Figure number 4.23. Now listen to me. Coming from downside. Okay. We have Iliolumbar vein, we have external iliac vein. We have internal iliac vein. Yes or no? Now, as we have seen in the thoracic venous return, in thoracic venous return, we have thoracic cavity which is equipped with intercostal muscles. So intercostal muscles have that means before the veins are fusing together. Listen. See, listen. Now, if you look at this particular picture, this is giving supply to one side it is going, another side also it is going. Yes or no? Yes or no? Now, don't look at the down one. Don't look at this part. What you are seeing is veins. These are supplied by. Now, this is your diaphragm. This is what we call it as diaphragm. No, this diaphragm is supplied by phrenic arteries. This diaphragm is supplied by what, ma?
Phrenic arteries.
What kind of arteries?
Phrenic arteries.
Now, downside, right iliac artery, left iliac artery. Right iliac artery and left iliac artery. So, here only your pelvis is present, here only your testicles are there, testicles are present, ovaries are there, means ovaries are present. That's why I am calling it as gonadal arteries. I am calling it as
Gonadal arteries.
So, they are clear till here. Yes or no?
Yes.
Now we have a stomach rise and abdomen. So from there stomach is coming and it is supplying and it is going. So you forget about that. So we have inferior mesenteric artery, superior mesenteric artery. Yes or no?
Yes,
So
sir.
what are the other organs present in this area? You people know. We have ascending colon, descending colon, spleen, gallbladder, liver. Yes or no?
Yes.
Stomach. So we know all those things. So now we forgot about that. Now we are talking about the venous return. So from right leg one vein is coming, left leg one vein is coming. They are both fused here. Yes or no? Yes or no?
Yes,
So
sir.
we call them as common iliac arteries. What we call as
Common iliac arteries.
So one is going to right side, one is going to abdominal artery. It is divided into two types. One I am saying the right iliac artery, one I am saying left iliac. Now this right and the left iliac arteries will divide into two types. So this one is internal, this one is external. So right side it came before it is divided into internal external. It is called as right iliac, common iliac artery. Right common
Iliac arteries.
So it is common iliac artery. It is right common iliac artery. Because why it is called as common iliac artery means it is not divided into two, right and left. Now when it is divided into right and left, it became right iliac artery, it became left iliac artery. Again, why I am saying right common artery means it has to divide into two. One has to go internal, one has to come external. So before it is divided into internal and external, I am calling it as right common iliac artery. I am calling it as
Right common iliac artery.
Now this internal is further divided, external is further divided. You understood? Similarly, you have venous return. You have what, ma?
Venous.
What is this venous return? You look at this. Now we have legs. Yes or no? Yes or no?
Yes, sir.
This is inferior vena cava. This is inferior
Inferior vena
vena.
cava.
Now we have right iliac vein. We have left iliac vein. Right iliac vein and left iliac vein. So this right iliac vein and left iliac vein. Similarly, while I am saying we have external iliac vein, we have internal iliac vein. Both external and internal are coming and fusing to whom? Inferior vena cava. Are fusing to inferior vena cava. Yes or no?
Yes, sir.
Yes or no? So we have internal iliac, external iliac. We have lumbar vein which is supplying blood to lumbar region. We have what we call renal veins which are coming from the renal arteries, which are coming from the renal glands, We have splenic vein. We have hepatic vein. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
We have testicular veins, gonadal veins, nothing but gonadal. If it is coming from ovaries, you call it as ovarian vein. If it is coming from testicle, you call it as testicular vein. You call it as testicular vein. Next we have azygous vein. We have suprarenal vein. What do we have?
Suprarenal vein.
So which are taking from the superior part. Which are taking from the superior part. Now we have blood supply to diaphragm. We have blood supply to
Diaphragm.
So from diaphragm also venous return has to come. Diaphragm also venous return has to come. So you call it as in phrenic veins. What are supplying to diaphragm? Phrenic arteries. What are bringing from diaphragm is phrenic veins. What are bringing from? Phrenic veins. So this is the venous circulation. So you have hepatic vein which is bringing blood from liver. Okay, right side means right hepatic vein, left side means left hepatic vein. We have phrenic vein which is bringing blood from diaphragm. Right side means right phrenic, left side means left phrenic. Next, we have right suprarenal. Right
Suprarenal.
superior part of your kidneys. Okay, what is present? The adrenal gland. What is present? Adrenal gland. So that's why we call it as right suprarenal, left suprarenal. Next, we have renal vein directly from kidneys. Directly from
Kidneys.
yes or no?
Yes, sir.
Next, we have gonadal veins. We have
Gonadal veins.
So gonadal vein is testicular means testicular.
Ovarian.
Ovarian means ovarian. Next, we have lumbar veins. Next, what do we have?
Lumbar veins.
So, which is collecting blood from the lumbar region. Which is collecting blood from the
Lumbar region.
Next, we have left and right common iliac veins. Left and right
Common iliac veins.
So, these left and right common iliac veins are bringing blood from both the limbs. Yes or no? Now, external iliac vein, internal iliac vein. Right external iliac vein, left external iliac vein. Right internal iliac vein, left internal iliac vein. This is the blood supply in the abdomen. This is the blood supply in the
Abdomen.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Because clear laabana నేను ఏం చేయలేను. Now we talk about portal circulation. We talk about portal circulation. Now these are all the areas which are there. So I will show you what is portal circulation. Answer. Time at 11:05. Okay, our diagram చూసుకోండి. Try to draw the diagram now. Arterial supply to the abdomen, venous supply to the abdomen. Try to draw. 4.23, 4.22. 4.23 and 4.22. Drawing.